Hello everyone. Today we'll be discussing the basics of squint evaluation. First, discussing that squint is of two types: the manifest squint, which is known as tropia, and the latent squint, which is the phoria. Manifest squint, we can actually, on seeing the patient, make out that there is some sort of deviation, while latent squint, the eyes will not reveal on the first glance that there is some sort of deviation. To assess for the squint evaluation, we'll be studying the four main tests today, which is the Hirschberg's test, also known as the corneal light reflex, the cover test, the cover uncover test, and the alternate cover test. First thing to note in this patient is when the patient comes to us, is there an obvious deviation or both the eyes are well centered? So the first scenario that we are discussing, that if it is equal, that the corneal light reflexes in both the eyes are equal, there can be two possibilities in this situation: that the person is actually orthophoric, that is, there is no strabismus present, or there could be a hidden squint, which is the phoria, heterophoria, that is present. Now, to bring out the heterophoria, we will cover one of the eye. This brings us to the cover test. So here we choose to cover the right eye. Here we choose to cover the right eye. So when we cover the right eye, we see that the left eye shows no movement, right? When the cover from the right eye is removed, if we notice that the right eye moves to recover fixation, it proves that there is heterophoria. But if right eye does not have to move to recover fixation, that means there is no phoria. We have to repeat this test by covering the left eye as well, the cover and the cover uncover test. Coming to the second scenario, where if the corneal reflexes are unequal, that we can see here that in the right eye it is centered, while in the left eye it is located a little temporally, which means that we are expecting a left eye esotropia, correct? So in this, we next do the cover test. To prove the heterotropia, we cover the fixating eye. Always remember that we always cover the fixating eye. In this case, it's the right eye. We see that the left eye has moved to recover fixation. And in a cover uncover test, where we remove the cover from the covered eye, which is we had covered the right eye, and now we're removing the cover from the right eye, and note the movement in the eyes. Neither eyes move, but fixation is now alternated, so it indicates that there is no fixed preference, but a tropia is definitely present. In the second scenario, both eyes shift with corneal reflexes same as beginning. That means the fixation is specific towards the right side.